Hello friends, welcome to Karunamai Sita channel, and here we have Dr. Trivikraman today with us, who is joining us from India to discuss about Ayurveda and how it helps with spondylitis. And I will introduce Dr. Trivikraman. He is an Ayurvedic doctor from Kerala, and he has worked for Korakal Ayurveda Vaidishala in India and in Muscat. And now he is having his own hospital in Kerala, where he is offering very comprehensive treatment plans in Panchkarma, as well as in yoga and the entire diet plan for patients. And he's a perfectly vegetarian doctor. And he believes in a proper regimen as well as treatment together. So welcome today, Dr. Trivikraman, to our show. Thank you so much for being here. And I would be happy to ask you a bit more wisdom about what spondylitis and spinal injuries are when it comes to Ayurveda, what doshas it imbalances, what are root causes, how we can get help with Ayurveda, with herbs and with diet and lifestyle. So I hope to learn something really good from you about spondylitis today. Thank you so much.
As everybody knows, spondylitis is the inflammatory changes which is happening in the spine. So usually we consider it as a type of arthritis when you say about spondylitis. If it is spondylosis, then it is a degenerative process which happens in the bone. So just like an osteoarthritis. And this prolapse and other things which happen because of so many reasons. It may be due to some injury, improper posture. There are so much of reasons for that. So usually whenever we get a patient, we have to see exactly what has happened in that particular person. So usually they will complain of the low back pain or radiating pain, or pain aggravates in the morning or when they sit or walk. So the symptoms will be differ from person to person. So first we will look into what they feel exactly. Then only we will see the X-rays, MRI, or whatever, just to finalize what is the exact problem. So if it is a degenerative disease like spondylosis, in that case also, we cannot give anything directly to strengthen the bone in the beginning, because as far as Ayurveda is concerned, there are so many parameters which we have to consider to fix a treatment. That starts from the digestion of the patient, and we should see how the bowel movement is. Then we have to see what type of body nature that particular person has, and we have to look into the reason what could be for developing a disease, whether it is an inflammatory or degenerative or whatever. And we have to see the place where he lives and in which season it aggravates. During the day also, whether it increases in the morning or in the noon time or in the evening or night, because these are all have relevance with the dosha. We have three doshas, Vata, Pitta, and Kapha. So usually if it is aggravating in the morning time, we consider the Kapha predominance. If it is the noon time, Pitta predominant. If it is the evening or after physical work exertion, then it will be more of Vata predominance. In that case also, if they have a digestion problem, first and most important, we give to correct the digestion, because the medicines we have to give orally. We don't have a painkiller. The pain relief we can do with therapies, and that also for temporary pain relief we will be able to give with therapies in the beginning if somebody comes with a severe pain. So usually we will give internal medicines to correct the problem. So if there is an inflammation, we have to give medicine for correcting the inflammation. Or if there is a swelling and some fluid accumulation or stiffness, then that we have to correct by increasing the circulation and correcting the purity of the blood. And if it is a degenerative process also, first we should be uh, able to reach that level with the giving medicines. Like if there is a digestion problem, then whatever we try to give to strengthen the bone may not take place because of the poor digestion, because the nutrients or whatever the active ingredients which we are supposed to work in that particular place will not take place if there is a poor digestion. So digestion, the correcting the digestion is the most important thing which we have to do in the beginning. And there are cases in which we can do some external application like oil massages, then different types of fermentations and all. But there are certain conditions where we should not do this also. So that we have to decide after a personal examination of the patient and after a proper interaction with the patient. Then we can fix what type of therapy they have to do. In certain cases, in many of the cases, sometimes we can reduce the issues just by giving proper rest and simple food, because I told you earlier also that correcting the digestion is the most important thing. So anything which is bit heavy in the system can create problem, and anything which increases gas problem, that can create problem. So usually we don't recommend any of such foods. It will be very simple food, very easily digestible food like ash gourd, snake gourd, then green gram, rice, wheat, tomato, uh, like, because usually the other pulses we don't give, then potato like things we don't give, chickpea like things we don't give, because it's a bit hard to digest. So those things we have to be very careful regarding the diet. And if anything is, if there is a problem in the circulation, if we suspect, then anything which is cool in nature also we have to avoid. Even if there is a degeneration, we may not be able to give even milk directly at that time. We have to wait for some time, then only we can give, then only it will work. Otherwise, usually we will think that there is a calcium deficiency, so we have to supplement it with something else. But if the body is not able to absorb that, means this is going to become a toxic substance in the body. So that should not happen. So there we will manage it with diet, then proper medication. Medication means we have a vast varieties of combination that start from necklace extractions, powders, tablets, arista. There are so many combinations we have. So it depends upon the condition, we have to decide what medicine we are supposed to give that particular patient. And we are not treating for the disease. Now, even if you say that it's cervical spondylosis or cervical spondylitis, our treatment is basically for the patient. So we have to see the condition of the patient, each and every aspect of the patient, to decide a treatment protocol.
Okay. Okay, so that means like, so it's not that there's one specific herb that will help. It is more like depending on the exact nature of the person that you have to help them out. Like every scenario you have to check.
One specific drug will not be helpful for everyone. It depends upon the body nature, because just like Vata, Pitta, and Kapha, we call it is dosha, which creates the imbalance, creates problem in the body. The same way we have Vata, Pitta, and Kapha, Prakriti, we call it is. That is the body constituency of a person. A person who is lean, who is having very dry hair, dry skin, a wavery mind. This type of personality usually we consider as a Vata Prakriti person. A person who is having early graying of hair, baldness, very short-tempered, who cannot tolerate heat, who is fond of sweets, these types of personalities usually we will consider them as Pitta Prakriti person. Kapha Prakriti person, they will be well built, they have patience. So we have to group first in which category this person comes, and that list is very long. Just for a general idea, I have just mentioned with this much. So that is one thing, and there are certain season again. It is explained, because just like in rainy season, the water predominance is more. But after the winter, when the sun comes up, at that time the kapha predominance is more. So each season, the Sharad, then Hemandam, etc., all the seasons which we have to consider. for accumulating the toxins and aggravating the doshas. So that should be there in our mind when deciding something. And I told you earlier that we have to consider in which place that particular person is living. If he is living in a place where more of, it's not a marshy land, like more of water and that cool breeze chances are there, the chances are there more for getting kapha like diseases. But if it is a dry area, then it's more prone to get vata type of diseases, especially in Middle East and all. You can Gulf countries, you can see more of this rheumatic complaints, especially they have this joint problem, they have psoriasis problem because of the dryness of the weather there, and they get more of stroke cases. So that place has an importance in fixing treatment. So when they plan to go back again after the treatment, means we have to specifically tell so many things to take care of those. Even the medicines also we have to decide as per that. So there are more than 10 cardinal things which we have to consider when deciding a medicine. That is why it is totally different. The approach is totally different from the modern medicine. Modern medicines, the protocol is same. If you have fever, you can have paracetamol. If you have pain, you can have one medicine. So in Ayurveda, the thing is, you can understand and experience these things when you have exposure to these things. So it needs time. So a fresh doctor also in the beginning, they will have difficulty to understand these things because 5.5 years is just nothing for them to learn Ayurveda. So again, they will go to some experienced doctors, stay with them, and then they will see the complicated cases, how we have to, because from each case, from person to person, it is different. Now we have two IVDP cases here, two disprolapse cases are here. In both the cases, the treatment are entirely different. So, well, actually the treatment is for the patient, for the person. That is the difference. So it is very difficult to say that these drugs will cure the problem. Sometimes it may work, sometimes it will not work.
Depends on the person, but spondylitis is more of a vata problem, right? Like it's arthritis, so it's like a vata degenerative disease.
It is spondylosis, you can say, because there the bony degeneration is there. Spondylitis means it's an inflammatory change. So it is just like an arthritis, this thing. There will be swelling, pain, tenderness, and all. But in other case, it is more of degenerative changes. So that is of more vata.
Okay, inflammation could be anything. It could even be kapha or pitta or vata causing.
Yeah, usually when pitta is there, more of that redness, burning sensation, that inflammatory changes will be more in that. If it is kapha, then usually that swelling, stiffness, heaviness, those symptoms will be more. And if it is vata, then more of pain and degenerative changes you can.
Okay. Okay, so that makes sense. That's it's very hard to give a perfect herb, name of a perfect herb. So even if there's like syrups like Bony Heal and all for helping your bones or anything, it is not advisable to give it to every patient. You have to understand their entire body system before you give any drug to heal their bones or anything, because they might not absorb it. That makes sense.
Cannot make any adverse effect because it's herbal combination. But in rare cases, some of the ingredients, if you use, it can create problem also, because especially that gugulu and all, if you prescribe in a wrong place, then it can create adverse effect. Even the pain, swelling, everything will aggravate.
Oh.
Even though it is recommended as a painkiller, it's good for pain, but if you cannot prescribe it properly by understanding the condition, it can aggravate the pain.
Oh, Gugulu can aggravate the problem.
Yeah.
Okay. That's very good to know. Thank you. That was really good information. why Ayurveda is specific to every body type. And thank you so much, Dr. Trivikraman, for explaining this to us today and taking out the time for us today. And thank you so much. And we hope to have you back on the show sometime again for another topic.
I'm also very happy to meet you and I get a chance to talk with you also. So happy with that also. We'll find another day to explain if needed more about this.
Okay, so any of the viewers who are interested in getting in touch with you, then your hospital is located in Kerala, and hopefully we will be able to provide some information about you in description where your hospital is. So if anybody is interested, they can reach out to you for any
If
treatment
you want,
related
I can
question.
WhatsApp a few information regarding our place.
Your WhatsApp information
Yeah. I can give
we can give. Okay,
just
so
to get an overall idea.
hmm?
Just to get an overall idea.
Yes. Okay. So we will provide your WhatsApp information for the viewers. So if they want to get in touch with you, and hopefully we'll have you back again soon on the channel. Thank you
Yeah.
so much today for taking out the
Yeah.
time. Thank you.